I'm Dr. Eric Goulder. I'm a cardiologist, and I've just opened the Heart Attack and Stroke Prevention Center of Central Ohio, along with Dr. Barbara McClatchy. We are a prevention center aimed at preventing heart attacks and strokes, and we do that by using the well-known Bale-Dineen method developed by Drs. Amy Dineen and Dr. Bradley Bale, who are here with us for the opening of the center.
Thank you, thank you. We're really happy to be here, and congratulations. Your center is amazing. It's really the first center in the country that places under one roof optimal dental, oral health combined with optimal prevention. And Dr. Goulder, for you to transfer all of your efforts from invasive cardiology, which you've expertly done for so many years, to say you're going to spend the next 30 years of your career for the prevention of heart attacks is really remarkable, because heart attacks are the leading cause of death in Central Ohio. So the work that you are doing and Dr. Barb McClatchy are doing is really tremendous, and we're so honored to be here to celebrate this great opening.
Well, thank you.
Yeah.
Yeah, we're actually excited to be here. Yeah, it's fantastic to see this center come to fruition, and we need more of these really around the United States. You two are the leaders in getting this type of clinic set up where you have medical and dental under one roof to help guarantee cardiovascular wellness and to prevent the heart attacks and strokes, which are still leading the list in terms of death and disability. So we're excited to be here. The people that should be even more excited are the people watching this in the communities in Ohio, that now they have this opportunity where heart attacks definitely are an option. It's not a destined thing to happen to somebody just because they have a big family history or genetically predisposed. As you know from our book, Beat the Heart Attack Gene, you can beat the genetic predispositions in every patient, and you know how to do it. And Dr. McClatchy also knows is right by your side to help when that dental condition is there driving arterial disease risk and risk for heart attacks and strokes. So congratulations. We're extremely excited for what you got going here. This is great.
For sure. And I would like to offer too to the medical and dental community of Central Ohio, sometimes there's a not understanding of what your work is going to offer the community. And what I want people to understand on the medical side and on the dental side is that you and Dr. McClatchy are here to support the current cardiologists and support the internal medicine doctors and to support the dentists in Central Ohio to augment their already excellent care. So the neat thing is, and Dr. Bale and I have been in clinical practice for many, many years doing this, what you two have is unique, because what physicians and nurse practitioners and dentists and dental specialists can do is make one referral. Simply send the patient to you, and your expert work will look at the genetics behind what's driving their disease, will assess their inflammatory burden, and at the same time, Dr. McClatchy can evaluate the oral connection to their inflammation, which we have learned and actually have published data most recently in postgraduate medicine indicating that the gram-negative periodontal pathogens that she is an expert to identify and treat are contributors to vascular disease. So with one referral, the physicians in this town can get their patients here, and you're not going to take their patient away, but offer amazing support to practice precision-based healthcare. So really, congratulations.
Thank you.
Yeah, that's definitely second that, but the other thing I'd like these healthcare providers to know is they need to come in and be assessed too, because healthcare providers are not immune to heart attacks and strokes. We learned that just a few days ago as a cardiologist who's the head of the American Heart Association had a heart attack.
In the middle of a presentation.
Yeah, so healthcare providers are not immune to this disease. They need your care so they can stay well and help their patients and help patients get here for the similar type of care. Because all healthcare providers have to know the standard of care as it is today is still allowing heart attacks and strokes to be number one in death and disability. And you know how to totally prevent it. So healthcare providers need to come in for their own wellness as well as send their patients here and you all work together. It's a perfect scenario.
So, you know, the death rate from heart attacks has been dropping since the 1950s, but certainly it's still the #1 killer. And we can use the Bale-Donine method and absolutely guarantee our patients that they will not have a heart attack or stroke on our watch. We can look at some very simple inflammatory markers, telling us if there's significant inflammation in the arteries. We can follow those inflammatory markers, make sure they stay under control, and absolutely put out the fire in the arteries.
Most
Yeah.
definitely, most definitely.
Yeah, and you're set up to provide the type of care that it takes for that individual patient. You set up your practice so you spend the time that's necessary with that individual person to really get to know them, get to know their genetic background, get to know their history thoroughly, work with them one-on-one with adequate time. And in the normal healthcare scenario, driven by insurance and government payments, that's hard to do. So you're offering something that most healthcare providers aren't offering, and they really can't if they're heavily involved in the insurance arena. So it'd be a great experience for those healthcare providers to see what can be accomplished when you have adequate time with a patient and you get to know them genetically as well.
Certainly for all those cardiologists out there, we've all seen the patient that you've put in a stent and they continue to have trouble afterwards with sort of rampant atherosclerosis, and you just can't chase all these lesions to keep putting stents in. We really need to get to the root cause of their inflammation that's causing the cholesterol to build up.
That's right. And one of those root causes is really a great example of why your center is so amazing. We have said for quite some time that periodontal disease is a medical problem with a dental solution. And your partner here at the clinic and at the center, Dr. Barb McClatchy, is a national expert on the identification of gram-negative periodontal pathogens, periodontal disease, and she and her hygiene team are second to none as far as treating these patients. So you as a cardiologist can have confidence to know that this significant contribution to vascular risk is eliminated here. And your focus then can be on all of the other root causes, which are quite grand. You've got genetically inherited lipid abnormalities, prediabetes, you've got sleep issues with Dr. McClatchy as an expert on sleep dentistry. You also have gut dysbiosis, all of these conditions that go above and beyond standard of care. So what you're saying, I think, and correct me if you're not, I believe you are, is that you are practicing the standard of care. You just don't feel it's good enough. And so what you're offering to patients is a optimal way to achieve health throughout their whole lifetime. Because now your goal is, if you do your job right, your patient will never feel the impact of your work. They will never have a heart attack or stroke. So it's wonderful what you have to offer here and to offer the non-invasive, very safe testing to look for, silent plaque in the arteries and going after it and treating it. Really, congratulations.
Yeah, no, Dr. Donine's point is extremely well taken. Our method is anchored in the fact that it's inflammation that causes arterial disease, and the fact that there are a plethora of conditions that can drive that inflammation. Dr. Donine and I have said for years, one of the easiest things for us to take care of clinically is the cholesterol. That's really a piece of cake. It's these other issues that drive inflammation of the artery that are tough. And one of them that it's impossible for us to take care of because we're not dentists is the periodontal disease and endodontic disease. Those diseases do drive arterial inflammation. We did publish in Postgraduate Medicine the first article stating that high-risk periodontal pathogens actually are causal of arterial disease. So it's wonderful that you're under this roof where any patient who has this type of periodontal problem can be taken care of. And let it be known that periodontal disease is extremely common. It's one of the most common reasons Dr. Donine and I run into for arterial inflammation. Once somebody's 30 years of age, half the population have periodontal disease. Once they're my age, 70% of the population have periodontal disease. So we're running into it all the time, but you're positioned extremely well to have somebody at your back, Dr. McClatchy, who can take care of that.
Most definitely. I'm curious, what technologies did you bring in to your center to provide this care in the Bale-Donine method?
Well, for one thing, we do carotid intermedial thickness testing, which is an ultrasound test. Simple, non-invasive, repeatable, to look for evidence of atherosclerosis. And as you've said, Amy, that we assume that everybody is guilty of having atherosclerosis until we prove they don't. Right. So we look very hard for that because it's important. It changes how we're going to treat people. Dr. McClatchy does oral DNA testing, looking for the DNA signatures from those 5 high-risk gram-negative pathogens. And we also have a 3D cone beam here looking for evidence of asymptomatic periapical abscesses.
Wow.
Yes.
And do you do advanced lab testing right here in the clinic as well?
Certainly. We look for certainly standard lipid panels as well as ApoB. We're looking for genetically abnormal lipids such as lipoprotein a. We're doing inflammatory marker testing.
Wow,
sort of
fantastic.
Yeah.
Very exciting.
One other thing I think listeners need to be aware of that they're going to receive when they come here for care, and that deals with a condition we call insulin resistance, or a lot of people view it as pre-diabetes. The fastest growing disease in the United States right now is type 2 diabetes. Most people aren't aware that they're headed there. They don't get diagnosed with pre-diabetes, so it's very hard for them to prevent it. When people come to this center, they'll definitely get diagnosed as being pre-diabetic. You do the testing that's necessary to uncover that. You can alert the patients that they're pre-diabetic. All type 2 diabetes is preventable. You know that, and you're going to give them a heads up that'll allow them to prevent it. The other thing listeners need to know is periodontal disease is strongly related to insulin resistance and how bad the condition is. So a lot of insulin resistance is being spurred along by periodontal disease, which will be taken care of in the center. I mean, it's just extremely exciting what you've got going on. And again, the people in Ohio should be thrilled that you've opened up this clinic, and healthcare providers need to get in here for their own wellness.
If they don't take care of themselves, who's going to take care of their patients?
That's right. That's right. And what you and Dr. McClatchy have established here is just a very safe, secure opportunity for someone who's a medical provider or a dental provider for once in their life to be vulnerable. Because this disease, again, is the leading cause of death and disability. And many of these healthcare providers are taking care of patients all day long, and yet their own health might suffer. And so we really want to make sure that the public, medical, dental, and the healthcare consumer understand that you're here as a service. And it's really an educational opportunity, because what you don't do, which is different than your previous life, you don't rush people through. And so what happens here is you walk in and you're greeted with just warmth and kindness, and for once, people can be vulnerable. And once they're allowed to do that, you're really allowed to do your amazing work, and Dr. McClatchy as well. So again, we're so excited to be here, so excellent.
And I want to thank Amy and Brad for helping to show Dr. McClatchy and I the way.
You bet. It's an honor. Congratulations.
Thank you. Thanks, Brad.